Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about cryotomy, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss rationale and aims, learning outcomes, indicative content, resources, submission of evidence, Q&A suggestions, some evidence ideas, reflective statement, and some helpful tips to make your portfolio better. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into this submodule. Rationale and aims of this submodule outline the general information and expected knowledge and competence that needs to be achieved when this submodule is completed. These are relevant to each submodule. For the cryotomy submodule, the expectations are that the candidate will have understanding of the principles and practice of producing cryosections for staining and evaluation. Will gain knowledge and understanding of processes employed during the production of high-quality tissue cryosection suitable for routine staining, special stains, IHC, or FISH. Will be able to produce suitable cryosections from variety of tissues. Will be able to apply their knowledge and understanding to recognize and solve common problems during cryosectioning. The learning outcomes demonstrate candidates' knowledge, skills, and competence in this submodule. They also include demonstration of the understanding of scientific principles, laboratory procedures, quality assurance, and professional conduct. They allow candidate to work autonomously and solve problems independently. Let's explore the first learning outcome, which is for the candidate to explain the principles and practice of cryotomy, comparing and contrasting its use with microtomy. What are the principles and practice of cryotomy? How do they differ from microtomy? Consider freezing, temperature control, embedding medium, cryosectioning, staining, advantages and disadvantages. What are the applications of cryotomy? Consider speed, preservation of specific molecules, no antigen retrieval, elimination of fixation artifacts, intraoperative cases, margins assessment for MOHS surgery, assessment of accidental finding, rapid evaluation, and so on. Try to compare and contrast cryotomy to microtomy as you explain the principles and practice of cryotomy. The second learning outcome is for the candidate to identify and discuss the risks and hazards associated with cryotomes and the difference in risk from microtomy, with particular reference to unfixed specimens. What are the risks and hazards associated with cryotomes? How do they differ from risks and hazards associated with microtomes? Consider shared risks like Sharp's injury, repetitive strain injury, different risks like cold burns, biohazards, pathogen exposure, fire or explosion risk, safety measures, PPE, SOPs, COSH, training and so on. Compare and contrast cryotomy and microtomy, fixed versus unfixed tissue, aerosolization, or disinfection difficulty. The third learning outcome is for the candidate to discuss application of frozen sections in cellular pathology, and its role in patient management. Why are frozen sections used in cellular pathology? What are the key applications of frozen sections? Consider nature of the lesion, intraoperative diagnosis, margins, emergency situations, accidental findings, confirmation of metastasis, MOHS, rapid evaluation, lymph node evaluation, specialized tissue diagnosis like Hirschsprung's disease and so on. What are the limitations of frozen sections? Consider artifacts, turnaround time, high-risk samples, diagnostic accuracy. What role do frozen sections play in patient management? Consider rapid diagnostic information during operation, surgical margins, metastasis identification, guiding the extent of surgery. The fourth learning outcome is for the candidate to explain workings of a cryostat and principles of rapid freezing of tissues and discuss how this relates to ice crystal artifact. How does cryostat work? What are the main parts of the cryostat? Consider cooling chamber, microtome, chuck, temperature control, anti-roll plate, UV decontamination, control panel. Why does the tissue need to be frozen rapidly? Consider ice crystal formation in the extracellular space and their effect on tissue morphology and interpretation. Also consider the principles of rapid freezing and why this is important. The fifth learning outcome is for the candidate to describe a range of diagnoses that may be made on frozen sections and explain why frozen section is required. Which diagnoses can be made from frozen section? Consider skin BCC and SCC to evaluate margins, MOHS surgery, lymph node involvement, to distinguish benign and malignant diseases, to identify tissue in accidental findings, to evaluate muscle diseases, assess metabolic disorders and so on. Why is frozen section required? Consider diagnosis, nature of lesion, surgical management and guiding extent of surgery, tissue viability confirmation, enable special techniques like molecular testing and so on. The sixth learning outcome is for the candidate to demonstrate preparation of high-quality cryostat sections and include examples of when it would be appropriate to seek assistance, advice, and give the rationale. How would you prepare high-quality cryosection? When would you seek assistance or advice? Consider your practical skills like embedding, setting up cryostat, cryosectioning, using anti-roll plate, staining, and decontamination. Also consider situations for seeking help like tissue difficult to cut, fatty, hemorrhagic tissues, persistent artifacts like crushing or rolling, equipment failure, safety concerns and so on. These will be highly training and competency dependent. The seventh learning outcome is for the candidate to demonstrate, with examples from candidate's practice, how to orientate and freeze tissues appropriately. How would you orientate and freeze tissue appropriately? Consider orientation of skin, tubular structures, muscle and nerve biopsies, suspicious nodules, fatty tissue, hemorrhagic tissue, samples that have been bisected. Also consider any special requirements samples can have and helpful hints and tips if you have some. Again, this is highly training and competency dependent. The eighth learning outcome is for the candidate to discuss the importance of preparing frozen sections in a timely manner for intraoperative diagnosis. Why is it important to prepare frozen section rapidly? Consider immediate surgical decision, optimal and rapid patient management, minimizing anesthesia time, maintaining tissue quality and viability, to enable ancillary studies, to rapidly assess viability of transplant tissues or organs, to rapidly manage accidental findings. The ninth learning outcome is for the candidate to demonstrate decontaminating cryostats appropriately. How would you decontaminate cryostat? Consider your practical skills in operating cryostat, UV decontamination, monthly decontamination, hoovering, the importance of when to decontaminate and why, following the SOPs. This again is highly competency dependent. The 10th learning outcome is for the candidate to identify problems which may arise during cryotomy and demonstrate troubleshooting as appropriate. What problems can you encounter during cryotomy? How would you troubleshoot them? Consider wrinkled or compressed section, curling, thick and thin section, tissue cracks, chatter, ice crystals. To remedy, consider optimal temperature, sharp blades, anti-roll plate, pre-cool tools. Indicative content highlights knowledge and understanding requirements that might be assessed during the viva. They may or may not be demonstrated by the learning outcomes or candidate's evidence. In the cryotomy submodule, candidate is expected to have knowledge and understanding relevant to the awareness of the main role of cryotomy and intraoperative diagnosis of a range of conditions. Consider nature of lesion, determining malignancy, surgical margins, guiding surgery extent. Relevant to samples that cannot be processed and why. Consider fat-related pathology, relevant to health and safety considerations of cryotomy, beyond that required for microtomy. Consider infectious risks. Relevant to standard staining of frozen section. Consider rapid H&E, enzyme histochemistry, etc. Indicative content also highlights skills the candidate is expected to be able to do. The candidate will be able to produce high-quality cryosection within appropriate time frame. Recognize common artifacts associated with cryotomy. And be able to correct common artifacts. Resources section on the Brightspace contains some very useful information. Submission of evidence on Brightspace informs the candidate what evidence needs to be submitted for each subsection. Candidate needs to submit answers to questions that were set by the training officer. I will share some examples of possible questions later on. Candidate also needs to select an additional piece of evidence relevant to this subsection. I will also share with you some ideas of possible evidence later on in this video. Each submodule requires the candidate to submit their reflective statement relevant to their practice and training in each submodule. Questions should be set by the training officer. They need to be based around the knowledge requirements, relevant for each subsection. They should allow the candidate to demonstrate their understanding in each subsection. The questions should be specific and relevant to the candidate's in-house practice. They should also allow the candidate to demonstrate their specialist knowledge. If you would like to see specific example questions, please have a look at the video for trainers. Link will be included in the video description. These are some ideas you could explore for your chosen piece of evidence. And some more ideas for your chosen piece of evidence. Each submodule also contains a reflective statement which is asking you, the candidate, to summarize your role in the laboratory in the context with each submodule. How do you demonstrate that you can draw a conclusion from what you have learned, reflect on your current practice and how it can change in the future due to gained knowledge? Think about what is your laboratory in context this submodule. What impacts can your actions have on your colleagues, department as a whole and for the patients? You also need to write a personal reflection on your training and why you chose your evidence. This is very personal to your own circumstance. It should demonstrate your ability to be self-aware when analyzing the gaps in knowledge. You can use it as an opportunity to reflect on aspects of your training, application of your gained knowledge and skills, and how you have achieved your goals. Think about what your evidence demonstrates. Why did you choose this specific evidence for this submodule? Also write what your training was like when it comes to this submodule and how your practice changed due to your training. The reflective statements can also be used as a CPD evidence in case you are chosen to be audited by the HCPC. I would also like to share with you some helpful tips that can make your portfolio look really good. Try to present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs or even videos, if you can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Try to make it a little bit more interesting to the reader, which will be your training officer and eventually the assessor. Try to put yourself in their shoes. How would you like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture is worth 1,000 words. I will make a video. I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also try to use various types of evidence, not just one type, like case studies, for each submodule. You could use experiments, case studies, annotated results, annotated photographs of you performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation and verification evidence, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Try to bring in your personality. Think about the ways you like to learn best. If you like experimenting, perform experiment. If you like troubleshooting, perform troubleshooting. Choose something that demonstrates your understanding, knowledge, skills, and how you apply this in your practice. And one more thing, keep the learning outcomes in mind when you selecting your evidence. Good evidence will tick off several learning outcomes. And this brings me to the end of today's video. Hopefully you now have a better understanding about the learning outcomes for this submodule. And I hope you also have a better idea what evidence you can choose to demonstrate your competence. And my final take-home message? Keep those learning outcomes in mind when answering questions and selecting your evidence. Bye for now.